heart autotransplantation is different from a normal heart transplant. Doctors don't replace your heart with someone else's. Instead, they carefully take your heart out of your body, fix the problem on a table, and put it right back in to start beating again. Doctors start by opening the chest and connecting the patient to a heart-lung machine. This machine keeps blood and oxygen flowing through the body so the heart can safely stop beating. Surgeons then carefully disconnect the heart from its major blood vessels and remove it completely from the body. The heart is placed in an ice-cold, sterile bath to preserve the tissue. Outside the chest, surgeons get an unobstructed. This allows them to carefully remove deep tumors or rebuild damaged valves that would otherwise be impossible to reach. Once the repairs are done, the heart is sewn back into the patient's chest. As warm blood flows back through its chambers, the heart begins to beat on its own again.